Good afternoon and welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for the Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us.
You're very welcome. I'm happy to join you again.
Thank you. My name is Mishka Balsam and I will be your moderator for the next hour. Thank you so very much for your patience. We have had a little bit of technical challenges behind the scenes where we couldn't see some of the mics and cameras actually being connected. So thank you for staying with us and allowing us to work through this part of the webinar. Since launching our webinar series, we have spent much time on looking at the economic impact of COVID-19, the information and subsidies needed, tax and legal implications, municipal and all levels of government consequences. And we've heard from business leaders about the measures that they have put in place to strengthen their business. While organizations and governments are responding to the ever-changing pandemic impact, businesses have questions, and we are very privileged to have Dr. Hirji agree to join GNCC's Espresso Live on a monthly basis, especially in these critical times. Today's format is where we are going to pass the camera mic over to Dr. Hirji, who will provide us with an update, which will then be followed by an interactive Q&A session. Dr. Hirji, and on that note, I'll pass it over to you.
So I'll try to keep this relatively brief because I'm sure there's lots of questions and I really want to put the time to making sure I'm answering what are others' concerns. But because you submitted some questions in advance, I can at least try and head off some of them. And I do want to kind of highlight what I see as the big themes around where we are and what we should be concerned about and planning for as we move forward. I just want to start off with this graph, which is a little bit out of date, but it illustrates, I think it's a really important concept for us to follow here. And as you can see, this graph is showing the January, February, March going into April period, the period between our second wave and our third wave. And you can see here, there's a period where our cases were declining and things were looking quite good. But under the surface, you have this orange line, which represented variants of concern that were rising in the background as a potential threat. Things were looking good overall when you look at the total number of cases. But as those variants of concern started to grow and grow and grow, it started to balance out the reduction in these blue parts of the cases, which are the non-variant cases. And so our total case count started to flatten out. And eventually, as the variants really took over, we saw our cases start to go up and we went back into another wave. And I'm just going to come back to that idea again, about having a threat that's growing underneath, that's maybe not apparent when we look at the top line numbers, and making sure we don't ignore that threat so we don't repeat the sort of message, error that we may have made back in the past. So going to look actually at the top line number, I think they look really good right now. This is looking at the Ontario case curve. So, our second wave, our third wave, and our cases have come down and down and down. And you can see where the Ontario case numbers are is that we're back to where we were in sometime in September. So, this is the best things have been in close to about 9 months in terms of our total number of cases, which is really excellent news. I've, very quickly talked about the reproductive number in the past, and this is a number that we want to keep below 1. If it's below 1, that means every person who's infected with COVID-19 is infecting fewer than one additional person. So your number of cases over time is going to steadily go down. And we continue to keep that number below 1, which is excellent, and of course, consistent with seeing cases coming down. There's good news when it comes to our hospitalizations as well. You can see after our third wave, we've seen our hospital numbers come steadily down, and now they're well below where they were between the second and third waves. And our ICU admissions, those are coming down steadily, and you can see pretty much everybody who's still hospitalized is largely someone in the ICU. And so that's largely a lot of people in previous weeks and even back into perhaps even May and April who are infected with COVID-19. We're still on their path to recovery. That number still remains quite high, but I think as we continue to keep cases low, we'll hopefully see this number continue to come down. And that'll, of course, relieve our hospitals and give us a little bit more margin of error and allow our hospitals to return to a lot of the surgeries that had to be canceled in past months. Looking at where the Ontario modeling is showing, we are just about here, just short of June 25th, and we definitely see our cases come down. We're below 500, and we're probably doing a little bit better than the modeling was actually showing. What the modeling was highlighting, though, is that when you reopen, and if you did a reopening on June 14th, you would potentially have an increase in cases again coming about 2 weeks after that reopening. We actually reopened on June 11th. And so I think one of the things to be paying attention to in the next week, couple of weeks, is to see, do we see that increase coming because of greater social interaction with reopening? Or are we able to keep the cases relatively flat and eventually get back onto another downwards trajectory? That's, I think, going to be one of the key things for us to look at in the next little while. Switching over just to look at the Niagara data, and I think it largely mirrors what we're seeing province-wide. We've seen our cases come down here in Niagara, and we are again, similar to where we were kind of closer to September, October. I just want to highlight this little bit here where our cases came down and they seem to flatten out for a week and a half or so. This was actually around the time that we were just about to go into step 1, and it was because of this flattening that I decided that we really need to keep the Section 22 order and food premises in place for a little bit longer, because I was worried perhaps we weren't going to see our decline in cases continue. Fortunately, that turned out not to be the case, and our cases have actually come down. And earlier today, I was actually able to send a notice out that we are lifting the restriction on dining within only one's household, because our cases have now come down to a much lower level. And I think it's safe for us to, take some chance and hopefully see how well we do with less restrictions on outdoor dining. So I think that's some good news there. The reproductive number here in Niagara, remains well below 1, exactly where we want it. And our hospital numbers here, seem to be coming down. Likewise, people in the ICU is coming down here in Niagara. So, at the top line, everything here is looking really good in terms of what's happening with our cases. I'm now going to switch away from looking at Ontario to actually looking across the Atlantic Ocean to the United Kingdom, because I think some of what's happening in the United Kingdom can give us some lessons of what we need to look out for. We have the benefit of seeing what they're going through and hopefully being able to prepare for it. And you probably know where this is going, and this is really about the Delta variant. You've probably all heard about the risk of the Delta variant. And this is some analysis done by the United Kingdom where they're looking at various different variants and the growth curves for those variants. And this is a logarithmic scale. But you can see that there's this one variant that is really growing much faster than all the others. And this is that Delta variant. I'm going to just take a look here at a breakdown of different parts of the United Kingdom. And I'll just focus on maybe some of the graphs on here. That what you see here is your non-variant cases, which have been going down. But you see this Delta variant curve in some regions of the UK, particularly in Northern England, where cases are really spiking very sharply due to that Delta variant. And of course, the combination of that means that you're going to see cases come very high. And this actually goes back to what I started off showing you, where for a while in the UK, it looked like their top line numbers, their cases are coming down, but they had a little bit of that Delta variant starting to build up in the background. And because they weren't aware of it, because they didn't have the good fortune of having seen other countries go through this, they weren't able to see what the impact of that is until it was too late, and they had this really sharp increase in those cases. This is a breakdown really of all the different variants in the UK. This is kind of a graph going up to 100%, and it's showing over time what the breakdown in variants has been. And so if you go back to March, pretty much everything is this pink color, and that's the Alpha variant. That's the variant that originated in the UK. And so almost all their cases were that Alpha variant. But you can see in April, you start to see this purple color, which is the Delta variant, start to build up. And it builds up over the course of April, course of May, and now it's actually risen to the point where it's over 90% of their cases are the Delta variant. And as I showed you before, that Delta variant has the potential to rise very quickly. And if we actually take a look at what's happened with the United Kingdom's case curve, this is their case curve over time. You can see through this, March, April period, their cases look like they're still coming down. And then they flattened out in May. And what you can see in the last 4 weeks is they start to have this very sharp increase in terms of their daily cases. And that's because underneath there here, they had that Delta variant slowly building up to the point where the Delta variant has become dominant. And now that Delta variant is really driving all of their cases up. And so they're seeing a new wave of infections, unfortunately, starting here. And then, I just want to remind everybody that UK was one of the world leaders in terms of vaccination. Their number of first doses is only a touch lower than ours in Ontario. They're about 63%, I think, of individuals have had their first dose, whereas we're about 65% here in Ontario. 2 doses, they're close to 50% of people have had 2 doses, which is higher than the 20% that we have here in Ontario. And so in spite of relatively good vaccination numbers, they're seeing this increase in cases. And so this is the big cautionary tale I think we have here, is that we want to make sure we don't see something like this, where that Delta variant is able to spread too widely and cause us to have another wave, despite our vaccinations, because our vaccinations aren't quite yet at the point that they're going to keep us completely safe from the Delta variant. Just as a point of reference, I'm just going to draw in what the Ontario curve looks like here. And you can see, what our curve has looked like with our cases coming down and how much higher the cases are in the United Kingdom. And, just comparing where they are to where we were at the peak of our 3rd wave or 2nd wave, they're starting to get, more than halfway to something along those lines. So what does it look like here with the Delta variant in Ontario? One challenge we have with the Delta variant is, unlike the Alpha variant or Beta variant, we don't have a screening test in Ontario to test for. So every person who tests positive for COVID-19, that lab sample actually gets sent for a screening test so we can identify what variant it is. But we don't actually have a test that works to identify what the Delta variant is. So if you do that screening test, you'll find if it's Alpha variant or Beta variant or Gamma variant. But if it happens to be the Delta variant there, it comes back as showing that there's no variant. The sort of good news is, in the sense, is that we don't actually have a lot of non-variant cases left in Ontario. I showed you that graph earlier showing that the non-variant cases have pretty much gone to 0. So what we're doing in Ontario is that if we see a case show up as a non-variant, it's not a variant, the assumption is it actually is the Delta variant. So if it's not detected as a variant, it's probably the Delta variant. And so this is what it looks like as the curve in Ontario for the last couple of months of cases where we can't identify a variant. And so, 95% of our cases were a variant case, overwhelming the Alpha variant. But you can see over the last 6 or 7 weeks that number of cases that we can identify as a detectable variant has been falling. And just drawing that line in here, this gap here is probably undetected Delta variant that's growing there. And so on a province-wide basis, you can probably see maybe 30% of our cases are now that Delta variant. And looking at that, it's starting to grow a bit more steeply. And so we are, maybe 6 weeks behind where the United Kingdom was. And we, I think, need to learn the lesson of what happened to them to make sure we avoid seeing a similar result as them. Showing you this story here in Niagara, where I think it's actually a little bit better when it comes to the Delta variant. So, we've hovered in, 95, 98% for quite a while. There's a little bit up there, but we got our numbers up higher. There's this 1-day drop here that could represent undetected Delta variant. This is a 1-day number only, so I think we'll need to see over the next couple of days if that's just a reporting delay and maybe this isn't as low as it is. Prior to that, we were down to around 94% from where we had previously been around 99%. So I'm thinking we're closer to probably about 4 or 5% Delta variant here as compared to the provincial average of 30%. So far, things are looking a little bit better here than they do on a province-wide basis. Just to kind of compare the whole, just to go back on this, you can see I've used a 80 to 100% scale. So I'm just going to move over to actually using a 0 to 100% scale. So you can get a better sense of this, and then looking at a few of the regions around us. So this is what things look like here in Niagara. So a little bit of a dip. So we're starting to see the Delta variant building. This is what it looks like in Ontario. So certainly not as much Delta variant in Niagara as there is in Ontario. But I want to look at Halton, Hamilton, and Waterloo, which is 3 nearby areas which have all been designated by the province as Delta variant hotspots. And so if we look at Halton, you can see they've had quite a sharp drop for a bit. It looks like maybe they've stopped some of the chains of Delta variant transmitting, and they've maybe come closer to the Ontario average there. The story with Hamilton, you can see, though they are also diverging from the provincial average. And so there's probably closer to 45–50% of Hamilton as the Delta variant. And if you see Hamilton and Halton, of course, near to us have a lot more Delta variant. That's probably why we're being pulled down, because of travel, visiting, people commuting between regions to work. That's allowing some of that Delta variant to enter our region and starting to see it start to build up. The one I really want to focus on here, though, is Waterloo, because this is what things have looked like in Waterloo, where they're probably at 80–90% of their cases are now the Delta variant. Sadly, the Delta variant has really taken over in Waterloo region. And if you've been following the Ontario case numbers daily, you can actually see that I think Waterloo had 97 new cases today. Next highest was, I believe, Toronto, which was somewhere in the 30s. So Waterloo really is now dominating as the place where the most cases are in the province, or at least the plurality of cases are in the province. And that's because the Delta variant has really taken hold of there. Now, just to show you what their case curve is looking like here, you can see they had the second wave, the third wave, and they've never really been able to pull out of that third wave because the Delta variant is still driving a lot of spread there. And in spite of having the lockdown like all the rest of us, they never quite got their cases down because that Delta variant has really given them some trouble. Just to give you a comparison of what this looks like in Niagara, you can see how much lower we are compared to Waterloo region. I also want to here compare it to Peel region, which is sort of the epicenter of COVID cases for a long time in Ontario. And you can see how high their third wave was, really going to the top of this graph. But you can see even in Peel region, where they don't have as much of that Delta variant, they've been able to drive their cases down while Waterloo continues to struggle. And the last one I want to point out is Porcupine Health region, which is really the Timmins area and then heading north up to the James Bay in Hudson Bay area. They have had quite a trouble with some Delta variant as well. And this is what their case curve looks like. So, throughout the year, they never really rose that high, certainly not as high as a place like Waterloo, because being farther north, they were relatively isolated. But you can see they had their second wave and they never really came out of their second wave. And they had this big resurgence of their second wave with the Delta variant. It looks like over the last week, they may be starting to get things back under control and bring cases down. But I think it's a reminder that, places like Waterloo, Porcupine have very similar vaccination rates to us, but that Delta variant is giving them real trouble in controlling cases and causing these additional waves of infection in spite of good vaccination numbers. And I think that is the threat that we need to be mindful of here in Niagara and really province-wide to hopefully prevent that from happening here. The reason why I think vaccination isn't helping as much with the Delta variant actually comes to this slide, where if you have the Alpha variant, you have one dose of vaccine, you have 60% protection against the virus. Once you get, the second dose, you move up to 90%. When you have the Delta variant, though, one dose of the vaccine is actually only 30–40% effective. This graph is showing 40, but really the newer data seems to show more like 32–33%. And so most of us only have one dose of vaccine, and so we're not very well protected against the Delta variant. And so if the Delta variant starts to spread, it can spread quite widely. The good news here is that if you get that second dose, you move up to 90%. So you get very good protection with that second dose. And so our ability to protect ourselves from the Delta variant is really going to depend on getting everybody vaccinated with a second dose faster than the Delta variant is able to take a hold here and start to spread. And I think the name of that game really means that we're going to need to be a bit slow and cautious over the next couple of months with our reopenings about remaining vigilant against the threat of COVID-19 to slow it from spreading, so we have enough time to get these second doses out to everybody. Just want to make a couple of final comments going back to the UK. This is where the UK is seeing the Delta variant spreading. This is an age pyramid, females on one side, males on one side in different age categories. And it's pretty obvious here that most of their cases are in teens and relatively younger adults. And that sort of makes sense if you think about the vaccination numbers. The UK, like us, rolled out first doses of vaccine to everybody and then has gone back and been doing second doses. And so elderly people are more likely vaccinated with that second dose, so they are relatively protected to the Delta variant. Younger people who don't have the vaccine to the second dose yet and in many cases may not even have their first dose, they're the ones who are most at risk from the Delta variant. And that's where we're seeing the concentration in their cases. And just looking at our vaccination numbers here in Niagara, so the orange here are second doses, the blue is then who only has a first dose, and then the little bit here is who's currently booked in to get their first dose. You can see, we're getting second doses up in our elderly age groups, and those elderly age groups really are maxing out in terms of people getting vaccinated, getting up to 100% or close to that there. It's our younger age groups here where we have a lot of people still not vaccinated, and of course, not many having had their second dose. And so they definitely remain the ones vulnerable to COVID-19 and particularly to the Delta variant. And even without the Delta variant here, just showing you how our cases are breaking down across different age groups, you can see that this yellow line was where most of our cases were. That's the 20 to 39 age group. And as our cases have come down, you can see the yellow line is the one that remains far higher than others. So definitely this group, which is the one that has lower vaccine uptake, remains where we're seeing quite a bit of spread of COVID-19. And so a big priority, I think, for us in the next couple of weeks is to really try and get young people to sign up for vaccines to make sure they at least get that first dose, and then hopefully bring them back for that second dose, because I think getting them vaccinated is going to be really key for us to make sure we're protected from the Delta variant. And with that, I think I'll stop there and turn it over to the many questions that I'm sure there are.
Thank you so very much for your update. It's really appreciated. And actually, by you giving the update, actually, it addresses some of the questions that have come in. But before we start our dialogue with our audience and attendees that we have here right now, a dialogue and a webinar like this has been made possible because of the partnerships that support them. Our appreciation for today's webinar goes to Norgen Biotech for all that they do for Niagara and internationally for the biotech sector. And here is a brief message from Norgen Biotech.
This is Norgen Biotech. We are a biotechnology manufacturing company based in Thorold, Ontario, Canada. This has been a busy year for us, with plans in motion to expand our facility, as well as producing testing kits for COVID-19. The people of Norgen have been working hard to serve their community. Now let's go see what the people of Norgen are up to. Hey Pam, do you mind telling us what you do here at Norgen?
Hi, sure. So I'm the Quality Assurance and Regulatory Manager at Norgen. So I oversee our ISO certifications and our quality management system, as well as work on regulatory submissions for our products with Health Canada, FDA, CEIVD as well.
Let's go to the lab to talk to our scientists.
I'm a research scientist, and I'm going to isolate the RNA from all the samples that we received to be sent for sequencing.
I am a researcher on our NGS team, and my job is to take the RNA that we isolate in the lab, put it on the sequencer, and then send it upstairs for analysis.
Let's head up to bioinformatics then, shall we?
I'm a bioinformatician here, and we analyze all the sequencing data based on customer needs.
This is only a portion of the work being done at Norgen. While each of these departments is essential to our success, we're thankful for our team in manufacturing for making our work possible. Although we make hundreds of kits, we'd like to focus your attention on what we are currently working on, which is our saliva collection device, as well as what we are doing to facilitate COVID-19 testing.
COVID-19 detection all starts with the sample. The sample can be collected through saliva or swab, is reserved and shipped to our lab. Once it's received by our lab, we isolate it using our silicon carbide technology. The samples then undergo PCR testing for the detection of COVID-19, which can be further analyzed by our NGS team.
The Ontario government was very instrumental during this pandemic, and it supported businesses across the province. We also get support for developing our novel saliva collection and preserving device.
Thank you, Dr. Hodge. Thanks for watching, and stay safe.
And thank you very much to Norgen Biotech actually for supporting such an important dialogue that we are having. Dr. Hirji, I'm really eager to get into the conversation, and because you spent quite an amount of time actually talking about the Delta variant, and there have been quite a few questions that have come forward. Many of them you have addressed, but one of the questions that has often been asked has come up in conversations with the strength of the Delta variant and its spreading. And especially when we take a look at an age group like the 18 to 29-year-old ones, where we in Niagara likely only have about 55 booked and confirmed having had the first vaccine, there is often the fear of a fourth wave that we have to deal with, maybe not imminently, but maybe in the early fall. Do you think this is likely, and when would it be expected to happen?
So I don't want to say it's necessarily likely. I think what we do from this point going forward is going to determine how likely it is. I think I showed you that, UK is already seeing that new wave starting up. We've seen what happened in Waterloo and Porcupine right here in Ontario and the trouble they've had controlling COVID-19. So I do think a fourth wave could happen in the next few weeks. I think it could also be pushed off much later, or we may actually never really get much of it. It might have a bit of a resurgence during cold and flu season over the winter, but not really be a true wave. And really what we do now, I think, is going to determine that. Key is, of course, 2 doses of vaccine to everybody is going to make a big help for that. And so we're going to be putting a lot of priority to try and engage and, get that group to sign up for vaccines. In the meantime, we do have everybody else really signing up for our second doses. We put up 20,000 appointments on Monday, and in 24 hours they were gone. So people are definitely signing up for vaccines. So that's certainly good news. The other part, though, is that while we wait to get those second dose numbers up, I think we need to make sure we're slow and cautious with reopening so we don't allow an opportunity for infection to start to spread widely. If we're slow and cautious, we can, reopen a bit, see what happens, make sure we still have things under control, and assuming we do, take that next step forward. If we don't have things under control, we can pause and do things to try and bring things under control. And I think that's really going to be the key thing, that we make sure we continue to have that patience so we don't let the Delta variant get the upper hand to start to take hold, while we continue to get those second doses out and try to vaccinate everybody.
Okay, I appreciate that. We have a question from one of our attendees, and they're indicating that they work with and have several family members of the younger generation not getting vaccinated, and they're consistently referring to the unknown impacts with fertility and citing this as a reason for not getting the vaccine. What are we doing to communicate what, if anything, is known about the impact on fertility to help the younger generation getting vaccinated?
Yeah, this is definitely a concern we keep hearing about. The unfortunate part is that there's actually no scientific basis to this. This seems to have been an internet rumor. There's no scientific study out there saying that there's any fertility issues with the vaccine. And actually, with an 80+ track record of developing all kinds of vaccines to all sorts of illnesses, we've never actually seen fertility be one of the side effects to a vaccine. So there's, almost certainly no truth to this. It's entirely a rumor spreading on the internet. And unfortunately, the way the internet works, this fear, I think, is scaring off a lot of people. So we are trying to do more messaging around this. I actually did a couple of town halls the past 2 nights where this topic came up, and we'll probably be clipping that question and answer and actually sharing that on social media to get the word out. But there's really no truth to this issue. The one good thing is, I've taken a look at the data of who has been getting vaccinated in those age groups, and actually it's more females have been getting vaccinated than males. So it looks like it's probably not widespread that people are concerned about this, but there's definitely a sizable population that's concerned.
Yeah, no, it makes sense actually. And I think any kind of more communication on this particular issue, I think is critical, and getting to the right people at the same time. It's a related question from another participant, and Lindsay, they're asking, what if you are unable to be vaccinated? What is the best way to stay safe being in the 35 to 45 age category?
Yeah, so first off, I'd say there shouldn't really be anybody who can't be vaccinated. The only reason you can't receive these current vaccines is if you have an allergy to the vaccines. There's very rare chemicals in the Moderna and Pfizer vaccines that cause allergies. If you happen to be allergic to one of those, you can actually still get the AstraZeneca vaccine because it has completely different allergy profile. So there really shouldn't be anybody who absolutely can't get the vaccine. Everybody should be able to at least get one vaccine. If you're not sure, you choose not to get vaccinated, I think obviously that means you're not going to be able to develop your immune system to protect you from COVID-19. So you need to make sure you don't come anywhere near the virus. And that means all the things we've been doing for the last year and a bit, making sure we stay away from other people, we limit our social contacts, we wear masks, we avoid crowded places. All of that ends up being what you need to do to protect yourself.
Yes. Dr. Hirji, we have been joined today by a high number of business people, and you had made reference to making changes or having announced changes earlier today to Section 22. And I'm being asked by a few people and texting us directly to saying, can you expand on that? The Section 22, as you know, has been extremely difficult for businesses across Niagara, has put them in an extremely vulnerable business situation. And anything that you can say about this one, I assume that because you're saying now that people can dine on a patio or gather on a patio that are not of the same household, but are there still the restriction when it comes to the number of people that can gather?
Yeah, so, first I want to just quickly acknowledge the really hard work and sacrifice that the restaurant and food services community has made. I think through no fault of their own, they cater to basically social interaction where people are seated close together and aren't wearing masks because obviously you can't wear masks when eating. And through no fault of their own, it just happens to be that's the activity that can potentially allow infection to spread. And so throughout this pandemic, unfortunately, they have had to make sacrifices to really keep the rest of us safe. And I think we should really acknowledge them and thank them for doing that because they have really made sacrifices for the benefit of all of us. What I've done is I announced earlier today that we have lifted the restriction on dining only within one's household. So the order, I think, had a few different provisions. That was a provision that I think was most difficult for businesses because that really limited the number of patrons that they could, parties that could come in. That's no longer an issue. People from many different households can now all come and dine together. Other measures of the order we're keeping in place, things like screening patrons for symptoms, making sure to collect information on them. So if we do have any spread of infection, we can trace back. Those sorts of things remain in place. I don't believe those were nearly as onerous because they weren't limiting the business, but I do recognize there is some additional cost and overhead from that. In terms of the restrictions, only 4 people, that was never with actually, that wasn't in our current order. That's actually a provincial regulation. So that remains in place right now. But when we move to step 2 on June 30th, that limit moves up to 6 people per table. So based on the province's decision to move to step 2, that'll move to 6 people per table next week.
Yes, thank you very much. And another question, and this one is more related to step 2. Today was announced that on June 30th, Ontario is moving into step 2. What are your thoughts on it? Is Niagara ready for it? And do you have any concerns about this?
Yeah, so I hate to be the negative person here, but I don't think we know yet if anybody is ready for this. When we do a reopening, it really takes usually about 2 weeks before we start to see the effect of it. And you really need to be about 3 weeks out to be able to look back over the previous few days to see what that impact is and assess it. The province had a 3-week timeline between steps, which was I think the bare minimum to know if the reopening was working, because you'd be at 3 weeks, be able to look over the previous few days, see what the impact was. Unfortunately, with the timeline to speed up, so we're at 13 days from step 1 reopening, we're not far enough out to actually know what the impact of step 1 is. So I don't think we know, is Ontario ready, is Niagara ready or not? Things have looked good over the last couple of weeks, but what we're seeing over the last couple of weeks is really the lingering effects of the previous lockdown. We haven't really seen the impacts of step 1. So I'm not very, favorable towards the province moving up the announcement on step 2 because I think it is premature, and I think we just don't know yet if we are ready for that step or not.
Dr. Hirji, can you give our listeners an indication of what impact you have if the provinces announces that we're moving to step 2 and when we're announcing that we're moving into step 3? I think often people are wondering about that aspect of it and saying, like, what is the role at a regional level and what is the role at the provincial level?
Yeah, for sure. And this has actually changed over time. So I think that can add some additional confusion. When we were working through the color-coded framework, which was actually applied regionally, there was usually a conversation that the province would have with us to validate that this is what we're seeing in the data. Does this match what you're seeing? These unusual trends, can you give us some additional context to understand, based on your local understanding, what might explain it, to give us some reassurance or some additional caution. And so through those conversations, you could help the province understand what might be happening locally and give some nudges of where you think maybe things should go. With this new framework of reopening, it's being applied on a province-wide basis. There's no regional by region differentiation. So there's actually no input that I have. There wasn't any conversation. I learned about the step 2 reopening through the media release this morning, like everybody else.
Thank you very much for that clarification, because I think that answers quite a few questions that have come in too, and that is specifically related to what is the best approach as we're looking at it, and should regions differ in their restrictions, for example, as they have in beforehand. But that is not the framework that we're working with right now, and so we can't look at that. Dr. Hirji, there's a question from Christine, one of our attendees, and they're asking, they're having employees that are traveling to the Waterloo region. Are there any additional precautions they should take beyond wearing masks and social distancing? And I think it probably likely doesn't only apply to Waterloo, it probably applies to other regions across Ontario that people are traveling to for private and personal reasons or for work.
Yeah, so I think the first principle here is, of course, COVID-19 will spread when you have close social interaction with others. So as much as you can limit that to a way it makes sense in your life, that's obviously going to keep you more protected. As well, if you get your vaccination and then you get that second dose of vaccine, that's obviously going to give you more and more protection, make it safer to partake in some of those activities. If you have a really important reason, of course, to say visit family or the like in a region like Waterloo where cases are much higher, obviously you want to go there and practice all precautions that you can. So when you're there, visit with the people you've come to visit with. Don't really have any kind of other interactions. Maybe don't go out and partake in some of the community activities or in the like, so you don't put yourself at any additional risk. You're there for the single purpose that you came with. Keeping distance from others, wearing masks are, of course, the other important parts of your protection there. And then after the fact, of course, always pay attention to your health. If you have any mild symptoms of illness, runny nose, a sore throat, a cough, a bit of a fever, anything like that, please do go get tested so we can make sure to find out if it's COVID-19, and if it is, we can do our work here in public health to limit it spreading to anyone else.
Thank you very much. I do have to go back actually to the topic of the Delta vaccine, because there's a couple of more questions that have come forward, but I'm wondering if I can wrap it more into one and hopefully address that. This specific one, I think that mirrors quite a few questions that have come forward, is from Hassan with RBC. And his question to you is, how effective are the current vaccines when it comes to the new variants that we have, and especially when looking at the Delta one?
Yeah, so I showed the slide earlier that with one dose of Moderna or Pfizer, you're looking at maybe 33% protection. With 2 doses, though, that goes up to close to 90% protection from getting illness. So that's really good news. The other part that I think is perhaps even more important is that while it's 90% protection from getting sick, it's about 96% protection from being hospitalized. With the AstraZeneca vaccine, it's actually really good as well there. It's a little lower to prevent illness. 2 doses of AstraZeneca vaccine, 70% protection from getting ill from COVID-19, but you're up to 92% protected from being hospitalized. So the really key message, I think, is you need those 2 doses. If you have 1 dose of either AstraZeneca, Moderna, or Pfizer, your protection goes down to more like 30%. So the key thing is that, as long as we're getting 2 doses of vaccine to people, these vaccines are actually going to work really well.
We appreciate that. And there's a question where someone is asking for clarification. When the governments initially spoke about, they spoke about 75% vaccination uptake of the 2 doses of it. When they spoke to it, did this indicate that the 75% was looking at the adult population or at the population as a whole?
It was actually for the adult population. And so, if we look at Niagara, we're just around that 75% mark. I don't remember the exact number, but we're sitting at approximately 75% of the 1 dose so far. Hopefully, because people chose to get that 1 dose, we'll at least get up to that 2nd dose. So, I'm very hopeful we'll be at least able to get at least 75% of adults vaccinated. And of course, 12 to 17-year-old children are able to get vaccinated. We've got about 46% of them vaccinated with 1 dose, and we hope to drive that number quite high as well.
Mhm. But just moving forward, when governments do talk about the 75%, we're actually talking about the adult uptake of the vaccine. Thank you for that. Because there's also a question about, and that has to do with the younger. And they speak about doses for younger children. We have made regulations when it comes to the 12 to 17-year-old ones now. What does it look like for the ones that are younger than that?
Yeah. So when our pharmaceutical companies developed the vaccine, they first tested it out on adults because you don't want to be doing any kind of clinical trials on children before you've done it on adults. And so the licensing was first for adults because we had the data showing it was safe and effective. The next phase was then to do the older children, which is the 12 to 17. And of course, Pfizer's now licensed for that group. And as I am hearing, it might not be very long before we see Moderna also licensed for that 12 to 17-year age group. What both those companies are actually doing now is they're now doing new trials to look at, I think, from 6 months to 11 years of age. And is the vaccine safe and effective in that age group? Timeline to get those studies done is looking like the early fall. Give some time for Health Canada to, review the data and license it. I think we're probably looking at near the end of the year that we'll actually have licensed vaccines for the younger children as well.
Thank you very much. I'm trying to get to a couple more topics too. One of them has to do with the board announcement that was made earlier this week. But there's a number of questions that are bringing us back to a vaccine and overall the way we move forward. And Dr. Hirji, earlier this week, I had a long email exchange with a valued business member here. And they continuously, it was not the only one, it's quite regular that we have these exchanges where they're saying, what if the new variant eludes an effective vaccine? Do we shut down again? What are the future side effects that really change actually the trust that we might have, our reliance on boosters? And the way they're positioned is they really are looking at it and saying, which is something we don't like in business, is that we're approaching it with a single solution management approach to it. Vaccine, and that is all that we have. But this, by all accounts, looks like it's going to be around for longer than we have ever thought initially, at least 16 or 17 months ago. What are your thoughts when you hear that expressed and saying, are we too focused on a single solution management approach to this issue that hinders our economy, our businesses, that significantly changes the landscape?
Yeah, so, first off, I'll say is, I think COVID-19 will never be completely gone. This is all about getting to the point where we've mitigated the risk enough that our hospital sector will be sustainable, we'll be able to keep our economy open and return to functioning normal. And we maybe render some COVID-19 to being something like influenza, which really stretches our hospitals every year, but doesn't overwhelm them. It's something that sadly kills, thousands of people in Canada every year, but it's something that we've been able to manage with. And I think that's where we're headed with COVID-19. In terms of controlling it, I absolutely agree. We need to have a, big spectrum portfolio of different measures that we're taking. I think we started off with not having vaccines, not having medications that could protect us. And so we unfortunately had to really rely on lockdown measures. And then, as we scaled back the lockdowns, at least some restrictions on social interaction in society to allow that to continue. I think with the big breakthroughs, of course, we now have vaccines, and with vaccines coming up, that really lets us lean less on restricting social activity, restricting the economy. There's still ongoing research to come up with better treatments, better medications. So if people do get sick with COVID-19, we can treat them before they get hospitalized, or we can treat them in hospital so they recover, so we don't sadly see deaths from that. Hasn't been as much research success on that yet as there has been on the vaccine front. So I do think we're trying to take that full spectrum approach, but science can only work as well as, we make those scientific breakthroughs. But we've been very fortunate to make that breakthrough with the vaccine. And I fully am concerned also about new variants that could potentially evade the vaccine. We're already seeing that with one dose, the vaccine is less effective. Fortunately, with those 2 doses, it remains almost just as effective. But the way variants emerge is when lots of infection is spreading. Every time it multiplies in someone's body, it can mutate and a new variant can emerge. And just the random chance of lots and lots of spread is going to allow variants to emerge. And the more we're able to reduce COVID spread across the entire globe, the less we're going to have new variants emerging. And so part of what our strategy now needs to be is that we vaccinate our population, but we need to pivot to helping the rest of the world vaccinate their population. Because if we can suppress COVID-19 in the rest of the world, that'll stop new variants emerging, and we'll be sure that we'll at least have a version of the virus we can control. And it'll, of course, bring COVID-19 cases lower elsewhere. So when international travel resumes, we won't have to worry about those infections coming back and affecting us.
Okay, thank you very much. I'm going back before I'm going to get into the border and the international travel issue. There's a question that has come forward from the school boards, the 4 local school boards, and the initiatives and strategies that you're developing on the safe return to school in September, both for staff and students. We have currently kids celebrating their graduation, the end of the year as it is, but what does September look like for them?
Yeah, so, one step we took early on here in Niagara is that we prioritized vaccinating education workers early on as a first step to try and make schools a bit safer. Of course, we have the 12 to 17-year age group is eligible to be vaccinated already. So we do absolutely want to try and get them vaccinated before the school year recommences, ideally with both doses, but at least with 1 dose, and then we can finish off that 2nd dose in the early fall. So those are the first steps I think that are going to make schools safer. I think another element that we have learned over the last year is understanding COVID-19 as a virus better. And we've come to understand that actually it spreads through aerosols, which can linger in the air a little bit. And that's part of what we didn't understand, I think, a year ago as well. So we actually are currently working on some work to head out into our schools and really help review their ventilation systems, their air circulation systems, to see what we can do about really making sure those are optimized as much as possible. That way that, if someone unfortunately does have COVID-19 in the school and is not identified, we're at least, cleaning, filtering, removing the air so that that virus doesn't linger there and potentially put others at risk. And then the final thing is, of course, we want to make sure what we did do this past year will continue, because I think actually a lot of those measures work. So, spacing children as far as much as possible within the infrastructure of the school, that, keeps people safe. I think probably mask wearing, at least to some extent, will remain something that happens in this upcoming school year. Maybe not for the entire school year, definitely probably in the worst part of winter, where we will probably see a cold, flu, and probably COVID season emerge. Continuing those measures, I think did actually help make our schools safer, will be something we'll want to continue as well.
Yeah, makes sense. Coming to the border issue, the federal government earlier this week announced a limited border reopening. It actually allows fully vaccinated Canadians and permanent residents to return without a quarantine, but not other foreigners. How do you feel about the limited border reopening on July 6th, and how will it affect things?
Yeah, so I'd actually not look at it as really a border reopening, because I think the border remains closed except for people who are traveling for essential reasons. So I actually don't really see it as reopening so much as that we're relaxing the quarantine requirement on a group who is at the lowest risk of coming back and bringing infection into Canada, which is, of course, people who've had 2 doses of vaccine. I think it makes sense that, as you get vaccinated, you're less likely to bring infection. So it makes sense to start to relax some of those restrictions on them. So it makes sense to relax the quarantine. In terms of an actual reopening of the border where people can start to travel across the border for non-essential reasons, I still feel probably something close to the end of summer is going to be the safer point to do that. At that point, we'll have most people vaccinated with 2 doses. We'll hopefully have kept cases low, and we'll hopefully, see the variant not really out of control here on the US side of the border. And that would still remain my advice to the federal government, but I'm not sure what their current discussions around this are.
Can you explain, and this is a difficult one for businesses, because it's hard to understand how a fully vaccinated Canadian can return, but a fully vaccinated American with approved vaccines can't come into this country. It's a difficult one to understand when your livelihood is the business that you have and you're trying to sustain, and we're kind of almost encouraging Canadians to go somewhere else while not accepting that. It's a difficult one.
Yeah, and I can't really defend it a lot. This is a federal government decision that I had no input in, and I don't know their entire rationale behind it. My best speculation is that they wanted to recognize that Canadian citizens who are coming back with 2 doses of vaccine probably aren't that much of a risk of bringing infection back. So we're going to extend that privilege to our own citizens, but the border remains closed except for essential reasons for travel. So we're not necessarily going to extend that privilege to everybody else yet.
Yeah. Two quick questions, conscious of the time. There's one from Christine, and they're asking about working in employees in a greenhouse and agricultural setting that are now getting their second dose of vaccine. And we have to imagine that there's extremely high temperatures of an environment that they're working in. Any chance that we might be able to relax a little bit the mask wearing one, which must be hard?
Yeah, no, that's a really good question. I think there's potential opportunity to do that. We'll probably want to align that, looking at when are we relaxing mask wearing really in society as a whole more broadly. But I think it's a really good point for something to have on our radar to potentially do in the upcoming next little while.
And on that same note, there's another question that has come forward. The Center of Disease and Control and Prevention has recently stated that fully vaccinated people do not need to wear masks when gathering outdoors. Mm-hmm. Is this good advice? And could we safely take our masks off when legally gathering outdoors in Ontario?
Yeah, so we'll need to follow what the provincial guidance on this is. I think the CDC is making that statement specifically if you have a group who every single person is fully vaccinated. And again, if you're fully vaccinated, your risk of getting infected is much lower, spreading it is much lower. So I think it is something reasonable to do. And especially, of course, outdoors, we know the risk is lower than indoors. I imagine we'll hopefully see something like that coming to Canada soon. But I think probably because we don't have as many people or as big a portion of our population vaccinated with 2 doses yet, we probably want to get to that critical mass before it's actually something relevant for most people that the governments here are going to announce that.
That sounds good. I want to touch on one thing as kind of a last question. It's related to the rapid screening kit distribution, something that's available throughout chambers in Niagara, Ontario-wide. The uptake has been really strong there. Is there a role that rapid screening kits can actually play in ensuring a quicker reopening? I'm looking at the step 1 that we're in, and I'm wondering if we had rapid screening kits available at the Penn Center, could customers have shopped? Is there an option or an application when it comes to those kind of kits and screening tools that might actually be one additional tool that will help out and support businesses?
Yeah, so those rapid screening tests are really effective for someone who has symptoms of illness. They're not as reliable when someone doesn't have symptoms of illness. If you have no symptoms, I think they're about 50% accurate in those stages, which certainly is better than nothing, but it's still going to let half the people through, so you're cutting down half the risk. Right now, to go into a lot of different businesses, for example, restaurants, we would want to make sure people don't have any symptoms of illness of going in. And so that's where the rapid test is going to give us the most benefit. For the people without symptoms of illness, sure, you're going to helpfully weed out at least half of those people who have had an infection. So I think it would be something good and helpful that would allow us to lower the risk, but I don't think it completely eliminates the risk. And so we probably need to be cautious about that. I think there's probably some opportunity, though, that we should start to maybe experiment a little bit with doing that. See how well it works, how effective it is at allowing a business to operate safely. And as we get more and more of that data, we'll be able to inform more going forward. I know the provincial government has done a little bit of this, but I haven't seen any of the results yet.
Thank you very much. Dr. Hirji, I'm looking at the time. We have about a minute left. I'm always passing it over to you for some closing comments. 30 seconds for some closing remarks here.
Yeah, things are looking a lot better right now in Ontario and in Niagara, and I'm very hopeful that we'll have the opportunity to start to really recover and sustainably recover our economy here. But the key thing is that Delta variant is a real threat. There could truly be another wave of infections because of it. And so I think it's really important that we're slow and cautious moving forward. And I know that's really difficult for a lot of businesses who've struggled, but I think it is over the long term really what's going to make sure we reopen sustainably and allow our economy to recover sustainably. And of course, making sure everybody gets vaccinated is also key. So anything you can do to convince the people around you who haven't yet been vaccinated to make that choice obviously gives us more and more margin of safety to do that reopening.
But Hirji, I wanted to thank you for your time. We're looking forward to connecting with you again in July for our next webinar. Each time we close the webinar, I'm thinking, I don't know what we really would ask in the next webinar, but so much is happening so quickly that I'm sure that we're going to have another full agenda. My thanks to everyone who participated in today's webinar and for all of your questions that you have brought forward. We really tried hard to address them all. And this recording is available on our website at gncc.ca. I really encourage you to sign up also for our daily updates that actually provide the business community with the latest up-to-date news of what is available to you, not only from a health measurement point of view, but also when it comes to subsidies and other rules and regulations. And lastly, my personal thanks go to Norgen Biotech for all that you do for Niagara, but also for supporting this important dialogue. And on that note, thank you very much. And I hope that each and every one of you will enjoy this upcoming month of summer. Stay safe.